Hey guys, Dr. David Warwick at Warwick Chiropractic and Massage in Lacey, Olympia, Washington, and I have Karen here. I'm going to be sharing with you one of the things that I first experienced even when I was in student clinic, and something that I was working in now, and that is working with patients that experience seizures. And while I'm not saying we should be replacing neurological medications for control, I am saying my experience in helping the patients is through an adjustment, the seizure frequency, duration, and intensity have gone down. And have you experienced the same thing?
Absolutely.
On some level?
Absolutely.
Hers are nocturnal. A patient that I had in student clinic actually had about 40 to 45 a day, petit mal, grand mal seizures. So I'm just going to share with you what I do in the office, in particular working with Karen and things that we've kind of worked through. And that was a cranial bone adjusting that you found pretty helpful.
Right.
Correct? All right, I want you to raise your left leg without bending your knee. Back down, and your right leg. Back down. Do they feel about the same?
Right. My left is a little weaker.
So I'm going to adjust apex of the sacrum. They were really close on that one, but you can tell the difference. So I'm adjusting right at the base or apex of the sacrum, base right up here. So raise this one, see if that was a little easier. Better, same, or worse?
It feels a little better.
A little bit better. So we're going to fine tune that, use the instrument. We're adjusting at S1 through 3 on the left side of the sacrum. Try it once again for me. Better, same, or worse? About the same?
Yeah, about the same.
Take a deep breath in and release it out. And we're going to do an adjustment in the cervical area. I do a light traction right through this area here, her right side. Good, and release. And I want you to lay on your back, please. Perfect, keep them like that, cross the arms, deep breath in, release the breath out. Good. Deep breath in, release out. Awesome job. Okay. And I'm just checking upper cervical, I'm right at C2, C3, left side right here. Good. Good, and I'm going to have you sit facing the chair to your right. Now, one of the things that we utilize is the change in the tips here. So when I do cranial bone adjusting, I change a tip out, and the cranial bones, or the bones inside our head or skull area, that actually move. They're held together by what we consider sutures. That's how they're joined together. And they almost fully ossify, but they still have a type of movement or vibration to them. So that'll change how the nervous system or how the spinal nerves exit and affect the brain. So right now I was adjusting the occiput, now I'm adjusting the parietal, temporal bone. Same thing on opposite side here. And then back here I'm going to the external occipital protuberance, the EOP. And I want you to slowly bend your head forward and backward. Good. Turn your head left and back to the middle. And I also adjust the sphenoid bone. The sphenoid bone contains a pituitary gland. So I'm doing a light traction on the sphenoid. That's right by the temple. And some of the pressure points along the trapezius, right where she gets some of those tender areas right between the shoulder blades. And checking the shoulders. We're going to adjust shoulders. You good? Adjusting at the clavicle, front of the humerus, and carries major, minor. So I also do some of the muscle points as well. Clavicle, front of the humerus, side, carries major and minor through there. So Karen, what have you experienced overall in your treatments since starting here? Now, you've been a chiropractor before, so you knew that was helpful as well.
Yes.
Yeah, so there was someone before me, correct?
Yes.
Okay.
For me, chiropractic is really the intensity of my seizures. It changes the intensity of the seizures. And the after effect of the seizure. I mean, if I do happen to have a seizure, without chiropractic, it can be 3 days recovery time. With it, it can be, I can wake up a little woozy and 30 minutes later I can walk away.
So that's a big deal.
It's a huge deal. So if I'm faithful to be in here somewhere between a week and 2 weeks time period on a regular basis, if I'm being good with my food combination, I don't know. That's a big difference in, you know.
Are you doing other therapies like massage or acupuncture or anything this time?
Right now, it's nutrition and chiropractic and my regular anti-seizure medication.
Yeah, that was changed recently, about 3-4 months ago, I think. They changed your medication.
Yeah.
Now, we didn't none of that was taken away, but they changed the kind. Did they increase it or bump it up by chance?
No. It was just a complete change to a different kind of medication. And you know anything about anti-seizure medications, your body runs through them and then you change to a different thing.
Yeah. It gets immune to it kind of. Yeah.
Right. And that's always a really hard adjustment for me. My body it takes a little bit longer. I don't know why, always has.
It's a neurological medication,
Right.
so it's altering the chemistry in the brain. It's very potent, you know, so not to be taken lightly at all, but just having the chiropractic and getting that has helped keep that epilepsy or the seizures down. I mean, we've still had some intense big ones that came up, but not as frequently. I'm not hearing about them as often.
Right, not as frequently, and the recovery times from what I have experienced in the past. I mean, I'm not just a bowl of Jell-O for 3 days. That's
Completely exhausted.
Right.
Understand on that. What would you share with someone else that's thinking about chiropractic and dealing with seizures?
Don't hesitate to try it out, and it may not seem like it's doing anything. It's the steady. You have to do a steady eddy with it for at least 6 months to actually see those benefits and keep track of the seizures over that amount of time, and then look at it, because it does make a difference, and you'll start to see that seizure intensity drop somewhere. Is it in the after effect? It may not be the seizure like your guy in school. It was his seizure frequency right away. That isn't the case for me.
Yeah.
It's after.
Yeah.
But it's different for every person. But be consistent with the amount of visits that you're going. It does make a difference. It really does.
Totally different than neck and back pain when you're dealing with the seizure capacity on that. It's not always a quick fix. I mean, in his situation, the medications were dropped, but same thing. His mother noticed that the seizures were less duration, frequency, intensity, and number in the day. I mean, significantly lower. So All right, guys, thank you for watching. I'm Dr. David Warwick, Warwick Chiropractic and Massage in Lacey, Olympia, Washington. I'll see you soon.